The crowds are back on the streets in Delhi. After 7 weeks, stores in one of India's biggest markets, Sadar Bazaar, reopened on Monday. Traders say they could not be more relieved.
Everybody, of course, is very happy because at one part we were losing our livelihood and also living in the fear of coronavirus. So definitely each and every trader of the market is very happy that finally both things are on the better side.
Like many other Indian states, Delhi imposed a strict lockdown in April in an attempt to slow down a devastating second wave of COVID-19. Those restrictions have reduced the number of new cases of the virus quite considerably, but they've also meant a substantial drop in people's incomes. The reopening in Delhi is taking place just a few days after the latest economic figures showed India's gross domestic product, or GDP, dropped by 7.3% over the past year, its worst performance since records began 70 years ago. More than 230 million Indians have been pushed into poverty in the past year, but migrant workers who lost their jobs when lockdowns were imposed are returning to the cities.
The cases are not as high as they were. That's why we have come back to earn money to feed ourselves. There aren't many ways to do that in the villages.
However, as restrictions are eased, state leaders are preparing for a possible third wave of the virus.
As per the calculations, we are preparing for a peak of 37,000 cases a day. We're calculating that if we reach this peak, how many beds and intensive care units would be required. And out of them, how much oxygen will be needed and the number of medicines that will be required.
Health experts say the most urgent task for India is to get more people vaccinated. And while the government addresses the shortage of doses it has available, it's also being urged to make sure basic COVID-19 protocols, including social distancing and wearing masks, remain in place.
We need to ensure that super spreader events, which have been the most dangerous pathways for the viral spread, are strictly avoided, both through public resolve as well as through administrative vigilance, till possibly December this year.
India's official death toll from the pandemic is 350,000, though health experts say the actual figure is likely to be much higher. As the country emerges from what's widely described as the worst crisis in its modern history, health experts say it's imperative the lessons learned are now applied. Elizabeth Puranam, Al Jazeera, New Delhi.